Have you noticed that the urge is just gone? Not gradually, but one day you realize it had been weeks, maybe longer, and something that used to feel natural now feels like a distant memory. That's not just aging, something is happening inside your body that nobody is talking about. I'm a urologist. I've worked with men in their 50s, 60s, and 70s for over 2 decades, and this is one of the most common things men bring to me, quietly, almost embarrassed to say it out loud. Here's what concerns me most. It's not the absence itself. It's what prolonged inactivity does internally, and most men have no idea there's a clock running. Tell me where you're watching from. And if this sounds familiar, you like and subscribe. Most men assume that doing nothing causes nothing, that if the body goes quiet, it simply rests. That silence equals stillness. But here's what most people don't realize. Your reproductive system doesn't work like a light switch you can flip off and back on without consequence. It works more like a muscle. And just like a muscle that stops being used, it begins to change. Quietly, gradually, in ways you can't see from the outside, but your body feels from the inside. I've been a urologist for over 2 decades. I've sat across from hundreds of men in their 50s, 60s, 70s, who came to me confused, tired, frustrated, with a body that didn't feel like theirs anymore. And when I ask them about this specific area of their health, most of them go quiet. Some look away. Some say, I figured it was just age. But here's what I tell every single one of them. Age is a factor, yes, but it is rarely the whole story. Let's start with what's happening biologically, because once you understand the mechanics, everything else makes sense. Your prostate gland is not a passive organ. It is constantly producing prostatic fluid, a component of semen that helps protect and transport sperm. This fluid is produced whether you use it or not. Every single day, your prostate is generating this secretion, storing it in the glandular ducts and acini, small pocket-like structures inside the gland. When ejaculation occurs regularly, these pockets are flushed and cleared. The fluid moves through. The system stays clean. But when ejaculation stops or becomes very infrequent, that fluid doesn't disappear. It sits, it accumulates, and stagnant fluid in a warm, enclosed glandular environment is not a neutral situation. Over time, that stagnation can lead to localized inflammation. The immune system begins responding to what it perceives as a buildup of cellular waste. Cytokines are released, microirritation develops along the ductal walls. In clinical terms, we call this a contribution to non-bacterial prostatitis or chronic pelvic inflammation. In plain terms, your prostate becomes chronically irritated without a clear cause you can point to. Men often describe this as a dull ache in the lower pelvis, a heaviness, discomfort that seems to come and go for no obvious reason. They take ibuprofen. They think it's a pulled muscle. They wait for it to pass. But the root cause, stagnant prostatic fluid, is never addressed because nobody ever told them that regular ejaculation is literally a form of prostate maintenance. Then there's the issue of tissue oxygenation. The penile tissue, specifically the corpus cavernosum, the 2 cylindrical chambers responsible for erections, requires regular blood flow to stay healthy. When a man has an erection, oxygenated blood rushes into that tissue. When ejaculation occurs, that cycle completes. The tissue is exercised, oxygenated, and maintained. But when this cycle stops happening for extended periods, weeks, months, the smooth muscle tissue inside the corpus cavernosum can begin to fibrose. It stiffens. It loses elasticity. The medical term is cavernosal fibrosis, and it is far more common in older men than most people realize. And once fibrosis sets in, it doesn't reverse easily. That's why I tell my patients, disuse is not neutral. Disuse is a slow form of damage. And then, perhaps most importantly, there is the question of what inactivity signals to your endocrine system. Your brain monitors your body's reproductive activity. The hypothalamus and pituitary gland are constantly reading signals. When sexual activity is regular, the brain interprets this as a sign that the system is functioning and in demand. It maintains hormonal output accordingly. But when the signal stops coming, when the body goes quiet for too long, the brain begins to respond as though the system is no longer needed. Hormonal investment starts to shift elsewhere. I want you to sit with that for a moment because it matters more than most men realize. Your body doesn't hold function in reserve forever. It allocates resources based on demand, and a system that shows no demand over time begins to receive less support. But here's the part that surprises most of my patients. The damage isn't just physical. What happens hormonally, emotionally, and neurologically when this system goes quiet is something we need to talk about directly. And that's exactly where we're going next. Here's something most men are never told clearly enough. Testosterone is not just about sex drive. I want to say that again because it gets misunderstood constantly. Testosterone is not just about sex drive. It is the foundational hormone of male vitality, and its reach extends into nearly every system in your body that determines how you feel, how you think, how you sleep, and how you show up in your own life. Now, here's what most people don't realize about the relationship between ejaculatory frequency and testosterone. It's not a simple direct line. It's a feedback loop. And when you understand how that loop works, you understand why silence in one area of your body can create noise in places you'd never expect. Let's talk about LH, luteinizing hormone. LH is produced by your pituitary gland, and its primary job is to signal the Leydig cells in your testes to produce testosterone. Think of LH as the message and testosterone as the response. Your brain sends the message, your testes respond, and testosterone enters the bloodstream. This cycle is supposed to be dynamic. It's meant to be responsive to your body's activity, stress levels, sleep quality, and yes, sexual behavior. When a man is sexually active with reasonable regularity, this loop stays primed. The nervous system remains engaged with that part of the body. Dopaminergic pathways, the reward and motivation circuits in your brain, are activated. Oxytocin and prolactin fluctuate in healthy patterns. The hypothalamus reads all of this activity as confirmation that the reproductive axis is functioning. It keeps sending signals. The pituitary keeps producing LH. The testes keep responding. But when sexual activity stops, when key natural NNNNNN, when weeks become months and the system sits unused, something subtle but significant begins to happen. The brain's investment in that feedback loop gradually reduces. LH pulses become less frequent, the Leydig cells receive fewer signals, and testosterone output begins to drift downward, not overnight, not dramatically at first, but steadily in a direction that compounds over time. I've had men come to me with all the symptoms of low testosterone: fatigue that sleep doesn't fix, a flatness in mood that they can't explain, loss of motivation for things they used to enjoy, difficulty concentrating, disrupted sleep. And when we look at their blood work, their total testosterone is in the lower range of normal, not clinically deficient. Just quietly low. And when I ask about their sexual activity, the picture starts to come together. Free testosterone, the fraction that's actually biologically active and available to your cells, is especially sensitive to this kind of hormonal drift. Because even when total testosterone appears borderline acceptable, free testosterone can be significantly suppressed by elevated SHBG, sex hormone binding globulin, which tends to increase as men age and as hormonal signaling decreases. The result is that your cells receive less testosterone signal even when the number on the lab report looks passable. And the downstream effects of that are real. Your mood regulation depends on testosterone. Your ability to build and maintain lean muscle mass depends on testosterone. Your bone density, your cardiovascular resilience, your cognitive sharpness, all of it is influenced by this one hormone. So when the signal begins to fade, it doesn't just affect your bedroom. It affects your energy when you wake up in the morning. It affects how you feel in social situations. It affects your patience, your drive, your sense of purpose. There's also a neurological dimension to this that I find particularly important. Sexual activity, specifically arousal and ejaculation, triggers the release of dopamine in the brain's reward centers. Dopamine is the neurotransmitter of motivation, anticipation, and forward momentum. When this system is regularly activated, it maintains sensitivity. But when it goes dormant for extended periods, dopamine receptor sensitivity can decrease. The brain's reward system becomes quieter, less reactive. Men describe this as a kind of emotional flatness, a reduced ability to feel pleasure, anticipation, or excitement about things that used to energize them. They often blame stress or age. But the neurochemistry tells a more specific story. The saddest part, and I say this with genuine compassion, is that most men never connect these dots. They manage their fatigue with caffeine. They dismiss their mood changes as stress. They tell themselves this is just what getting older feels like. But it doesn't have to feel this way. And this is where most men get it completely wrong. They treat the hormone, but they ignore the trigger. They look at testosterone replacement without ever asking what caused the decline. And that missing question is exactly what we need to address as we move forward. Now, here's the mistake most men make when they think about prostate health. They think about it in terms of cancer risk and not much else. They get their PSA checked once a year, maybe get a digital rectal exam, and they consider the box checked. And yes, those screenings matter, but there is an entire dimension of prostate health that almost never comes up in a standard appointment, and it directly affects how you feel every single day. Here's what most people don't realize. Your prostate is an active secretory gland. It doesn't just sit there. Every day it produces and stores prostatic fluid, a zinc-rich, slightly alkaline secretion that plays a critical role in male reproductive function. This fluid is designed to be expelled. The ducts that carry it are designed to be flushed. The entire architecture of the gland is built around a cycle of production and clearance. When that clearance cycle is interrupted, when ejaculation becomes infrequent or stops entirely, the fluid that was meant to move begins to stagnate inside the ductal system. And stagnation in a biologically active gland is never benign. Here is what happens on a cellular level. Prostatic fluid contains a complex mix of proteins, enzymes, and zinc ions. When this fluid sits for extended periods without being expelled, several things begin to occur. The zinc concentration, which normally plays an anti-inflammatory and antimicrobial role, becomes disrupted. Proteins begin to break down. The local pH shifts. Immune surveillance increases in response to what the body perceives as cellular debris or altered protein profiles. Mast cells release inflammatory mediators. Macrophages begin moving into the area. The result is a state of low-grade chronic inflammation. And chronic inflammation in the prostate gland has implications that extend far beyond discomfort. Clinically, this manifests as what we call chronic non-bacterial prostatitis or chronic pelvic pain syndrome, conditions that affect a significant number of men over 50 and that are notoriously difficult to treat with antibiotics because the origin isn't bacterial. It's mechanical, it's a drainage problem, and the solution, though rarely discussed in these terms, involves restoring the natural clearance cycle. Now let's talk about PSA, prostate-specific antigen. Most men know PSA as a cancer screening marker, and it is. But PSA is also a marker of prostate activity and inflammation. When the prostate is chronically irritated due to fluid stagnation, PSA can rise, not because cancer is present, but because the gland is inflamed and more permeable to PSA leaking into the bloodstream. This can lead to unnecessary anxiety, unnecessary biopsies, and a cascade of medical interventions that trace back to something that could have been partially addressed through lifestyle and behavioral patterns. I've seen this in my practice more times than I can count. A man comes in, his PSA has ticked up, he's terrified. We do further workup, and there's no malignancy, but there is clear evidence of prostate inflammation. And when I take a thorough history and ask about sexual activity, the timeline often lines up precisely. Months of inactivity followed by rising PSA and increasing pelvic discomfort. There's also an important connection between prostate stagnation and urinary symptoms. The prostate surrounds the urethra, the tube through which urine flows. When the gland is chronically inflamed and slightly engorged from fluid accumulation, it can compress the urethra and cause symptoms that mirror benign prostatic hyperplasia, weak stream, increased frequency, incomplete emptying, nighttime urgency. Men in their 50s and 60s often accept these symptoms as inevitable. But in some cases, regular ejaculation, by reducing prostatic fluid buildup and inflammation, genuinely improves urinary flow. That's not speculation. That's basic glandular physiology applied consistently. The evidence supporting regular ejaculation as a prostate health strategy has been building for years. A landmark Harvard study following nearly 30,000 men found that those who ejaculated most frequently had significantly lower rates of prostate cancer over the follow-up period. The biological rationale aligns with everything I've described. Regular flushing reduces the opportunity for carcinogenic substances to accumulate, reduces chronic inflammation, and maintains healthier cellular turnover in the glandular tissue. Now, here's what most doctors never explain about reversing this, and it has nothing to do with medication. It has to do with consistency, timing, and a few specific lifestyle elements that directly support prostate and hormonal health. And that's exactly what I want to walk you through right now. Here's the good news, and I want you to hear this with the same calm certainty I use when I say it to a patient sitting across from me in my office. This is not a one-way door. The body has a remarkable capacity to respond when you give it the right conditions. I have seen men in their late 60s, men who had written off this part of their health entirely, restore meaningful function and vitality simply by understanding what their system needs and providing it consistently. It doesn't require extreme interventions. It requires informed, patient, consistent action. But here's what most people don't realize. And this is important. There is a right way to restart this system, and there is an approach that backfires. Men who become anxious about their performance, who put pressure on every encounter as a test, who catastrophizes every imperfect response, they actually worsen the hormonal and neurological environment they're trying to repair. Cortisol, the primary stress hormone, is directly antagonistic to testosterone. It suppresses LH. It reduces Leydig cell sensitivity. It constricts blood vessels and reduces genital circulation. Anxiety about function becomes a biological obstacle to function. So the first thing I tell every patient is this: approach this with patience, not pressure. Now let's talk about frequency. Research consistently points to a target of roughly 2 to 4 ejaculations per week as a range associated with optimal prostate health, healthy testosterone signaling, and tissue maintenance. I'm not prescribing this like a medication. I'm telling you what the evidence suggests as a general target for men in the 50 to 75 age range. Your individual situation matters, your health history, any medications you're on, any underlying conditions. But as a starting point, 2 to 4 times per week is a reasonable, research-supported goal for most men. For men who have been inactive for an extended period, I recommend a gradual restart. Don't go from zero to aggressive overnight. The system needs to be coaxed back online, not forced. Think of it the way a physical therapist thinks about rehabilitating an unused muscle: gentle, progressive, consistent loading over time. Now, let's talk about the lifestyle elements that directly support this process, because frequency alone isn't enough if the underlying physiological environment isn't supportive. Zinc is the first thing I address. The prostate contains a higher concentration of zinc than almost any other tissue in the human body. Zinc is essential for testosterone synthesis, for the health of the prostatic epithelium, and for the enzymatic reactions that regulate hormonal balance. Men over 50 are frequently zinc deficient, often without knowing it, because zinc absorption decreases with age, and many Western diets are poor in zinc-rich foods. Oysters are the most concentrated dietary source. Pumpkin seeds, red meat, legumes, and nuts are also meaningful contributors. If dietary intake is insufficient, a modest zinc supplement, 15 to 30 milligrams daily, is something I often recommend under appropriate clinical supervision. Sleep is the second factor I emphasize, and men consistently underestimate its importance. The majority of your daily testosterone is produced during deep, slow-wave sleep. Studies have shown that reducing sleep to 5 or 6 hours per night can drop free testosterone levels by 10 to 15% in as little as 1 week. If you're not sleeping 7 to 9 hours, if your sleep is fragmented, shallow, or chronically short, you are actively undermining every other effort you make in this area. Sleep is not passive recovery. It is the primary manufacturing window for the hormones that make everything else work. Circulation is the third pillar. Penile tissue health, erectile response, and glandular function all depend on robust cardiovascular flow. Regular aerobic exercise, walking, cycling, swimming, directly improves endothelial function and nitric oxide production, which is the primary mechanism behind healthy blood flow to the genitourinary system. Even 30 minutes of moderate aerobic activity 5 days a week produces measurable improvements in erectile function and testosterone levels within weeks. And finally, reduce alcohol. I say this not as a moralist, but as a physiologist. Alcohol is directly toxic to Leydig cells. It suppresses LH, it disrupts sleep architecture, It elevates estrogen by activating the aromatase enzyme. Even moderate regular drinking 2 drinks a night creates a hormonal environment that works against everything we've been discussing. Put these together: consistent frequency, zinc, sleep, circulation, reduced alcohol, and the system responds. Not instantly, but within weeks to months, men begin to notice the difference. Energy improves, mood stabilizes, morning erections, a reliable biological marker of testosterone health, begin to return. But none of this works long-term unless you understand the one thing we haven't yet addressed: the emotional and psychological layer that either supports or undermines everything else. And that's where we're going to land this conversation right now. I want to come back to where we started, and because I think it matters. When I described that moment at the beginning, the quiet realization that something had faded, the embarrassment of not knowing who to tell or what to do, the private sense that your body had somehow moved on without you, I wasn't exaggerating how common that experience is. I hear it constantly from men who are otherwise healthy, accomplished, and fully present in every other area of their lives. This particular silence is one of the loneliest ones there is. But here's what I need you to understand clearly and without any softening: what happened was not betrayal. Your body was not failing you. It was responding to signals, or more precisely, to the absence of them. The system went quiet because it received no instruction to stay active. That's not a character flaw. That's not irreversible damage. That's biology doing exactly what biology does, allocating resources based on perceived demand. And now you have the information to change that signal. You know what's happening in the prostate when fluid stagnates. You know what happens to the hormonal feedback loop when the brain stops receiving confirmation that this system is being used. You know what tissue health requires. You know the practical steps: frequency, zinc, sleep, movement, stress reduction. None of this is beyond you. None of this requires a prescription or a specialist or an expensive intervention. It requires understanding, intention, and the quiet decision to take this part of your health seriously. That's all this was ever about, giving you the knowledge your body was waiting for you to have. You're not old, you're underinformed, and now that changes. If this conversation met you where you are, if something in here felt like it was spoken directly to you, then you're exactly the kind of man this channel exists for. Men who take their health seriously, men who don't want to be talked down to or sold something, men who just want honest, clear information from someone who actually understands the biology. If that's you, consider subscribing, not for me, but because the conversations we're going to keep having here are the ones most doctors don't have time for in a 15-minute appointment. Next time, we're going to talk about what happens to testosterone in the early morning hours and why the first 45 minutes after you wake up may be the most hormonally important window of your entire day. Until then, take what you learned here today and do something with it. Your body is listening. It always has been.